I'm on call in case they want me to watch the recount. I've already spent about 8 hours watching recount, like watching paint dry, guys, but somebody's got to do it. But it doesn't look that the recount is going to do much on the change of the election, but the Beasley protest petition included absentee ballots that need to be reviewed. These have more of a chance of making a change. Also, Newby's petition mentioned voters that died between the time they voted and election day, and these votes are not supposed to count. So these protests and petitions have a bigger chance of affecting the outcome, but they won't be heard in Durham until November 30th at 5 p.m. So if you want to see that, you can get on the Durham County Board of Elections site, and you might be able to watch the discussion live. But this is still going on. North Carolina rolls out county alert system. I have the link here for you to look at. They have every county rated red, orange, and yellow. We're yellow. Wake County is yellow, but you don't have to go very far. Johnson County and what's the one on the other side of Orange County? At what? Alamance. Alamance and Johnson County and Guilford County are all red. So if you leave town, do not stop and get gas in those areas. In fact, I'd be tempted to stay in the car till you got all the way to Asheville. It's that map is up, and you can see which counties are doing better, are doing worse, and which are doing better. Governor Cooper announces stricter mask mandates. He says wear them inside if you're with people that aren't in your family. Wear them if you go to social gatherings. He's also limited gatherings to 10 people. They had originally been, before a little while ago, they've been limited to 25 people. Now they're 10. So those are the two latest things from Governor Cooper. Wear your mask all the time when you leave home, and guidance on social gatherings, particularly limiting them to 10 people. In the county, there's an issue here in North Carolina about end-of-year testing for people in the public schools. Some parents have chosen not to have their kids in school at all. They're still doing like Durham, for example, is doing all virtual, but they're making the end of year test be done in person. They're still arguing that out. So if you know anybody that's supposed to be doing end of year testing, you might want to check that out. They have some new demographic information. Now the African Americans are not overrepresented, but the Hispanics still are. Whites are underrepresented. African Americans are underrepresented. And the Hispanic Latina community is still overrepresented. Not good for the Hispanic community. There's a zip code map. The worst area is 27704. This is on a per 100 basis. So that you have the county basis, and now you have the zip code basis within the county. So if you want to see that link, you can see what the different zip codes are, and that's all the legislation that's fit to print at the moment. Anybody have any questions on it or any comments?
This is Jane. I have a comment. My comment is, while Durham is still holding a disproportionate amount of COVID for Hispanics, the state as a whole has flipped, because now you're having more Caucasian people in the state as a whole of having it, and a slightly higher proportion of women. So that demographic is different in the rural areas of the state than it is for the urban areas like Durham. Also, just on another COVID note, it is indeed good news that we have now 3 vaccines that have been shown to be surprisingly effective. The latest one, which is AstraZeneca, doesn't need to be frozen at minus 90 degrees. So, and it's also being supposedly going to be made near cost at $3 a shot. So it may be the one that gets more widespread world use. But we are not going to have available vaccines for months, and it will be a tiered system. We'll see if the Biden administration adopts what so far has been said by the CDC, and the tier 1 will be healthcare workers and nursing home workers, and tier 2 is people at risk, of which all of us are in that category because of age by at least. And then 3 and 4, you know, it's going to be a while before people get vaccinated. More people now are saying that they want to be vaccinated, but we still have about 42% that are saying, well, I got to wait and see what FDA and everybody else says, you know, about how safe this is. So my bottom line is, while there is light at the end of this tunnel, we are still in the middle of the tunnel. And if you go out, you know, you're really risking yourself. CDC has said, absolutely do not go on a cruise. And I'm getting inundated with emails from the cruise industry. I've come take our cruise. So, you know, you just really got to use your head. And it's as wearing as this is to be hunkered down, we need to do that. And from this Thanksgiving thing, we could have up to 500,000 people dead by Christmas. I mean, that's just how bad it is. And people are making choices about, well, I'm going to want to go see the grandkids. So, but there is good news on the medical front, and there is good news that we may finally have some sanity at the federal level.
Thank you, Jane. Does anyone else have any questions for Nancy about her legislative update today?
I've got 2 comments. One is, Jane is right about 500,000 people dead due to COVID. That's 14 times the normal traffic deaths in the U.S. So it's serious. Second of all, if you there are some places you can go out and put your name on lists to say that you don't want advertisements. And I think it's an advertising association. And I found that it cuts down all the credit card offers and things like Jane was talking about, advertisements for cruises.
Well, I just like to say I'm changing my plans. I was going to eat dinner with my older son and my grandchildren, but we're going to go do s'mores and hot chocolate outside for just a little amount of time this evening. So I've made changes. I'm not seeing my grandkids as much. We're not going to have the kids over here for Thanksgiving. So my kids do not want to be responsible for getting us sick, I guess. So they're willing to make changes. And I'm sure everybody here is making the same kind of decisions. So it's going to be hard, but hopefully next year this time it might be better. I hope. So if there aren't any other questions, we can pass it back to you all.
Thank you very much, Nancy. That was always as wonderful. And I want to remind people that the legislative update is available on the invitation as a file you can download. Also, we have the legislative updates for all the previous months that are uploaded to our Facebook page on the files section. And if you are not able to access that, just send me an email and I'll provide you with those files. And of course, my email you already have, that is link.thom@gmail.com. So we're going to go now on the menu back to our program speaker today, and I'm going to ask for Mary Vickers to actually introduce our speaker today. Hi, Mary.
Hi. Our speaker for today is Mrs. Diane McKinney. During Ms. McKinney's career, she worked with sales and marketing for Blue Cross Blue Shield of Massachusetts and Blue Cross Blue Shield of North Carolina. She was responsible for negotiating access to provider networks and pricing for members who live or travel to other planned service areas. She retired in 2017, and for the last 4 years, she has supported the Federal Employees Program sales and marketing team during open season statewide. So please help me welcome Ms. Diane McKinney to give us the update for Blue Cross Blue Shield today.
Hi, Diane. Are you there?
Yes, I'm here, and I've removed myself from mute, but for some reason I'm not showing that I'm on video with you guys.
Okay, wait just a second, and I'm going to fix that for you.
Okay, thank you.
Let's see here. I'm sorry. Okay. I need for you to start your video.
Okay, we can start there. Okay, and now I'm there. And now, and good morning. Thank you for letting me into your homes this morning and sharing your very important meeting with regard to the 2021 open season with questions and answers that will impact your health insurance choices potentially for this coming year. So I would ask, as Thomas stated, for you to place yourself on mute. If you have a question, I will pause periodically. Anything you would like to ask, if I can't answer it, I will jot a note down and we will respond later. Also, your consultant, Sonia Smith, will provide you with copies of the presentation materials. But for today's meeting, I'm actually going to walk you through what can be found on the FEP website. So this will be identical to the 3 documents that she will forward that you can load to your sites where you keep your various notes, and that will be on your medical, your dental, and your vision. So that is what I'm tasked with today, is to basically walk through those benefits with changes, updates, questions that you may have. And Tom, I'm not certain yet if they are able to see my video here, and I guess I need to switch to share.
That's right.
Okay, so we're gonna
and just to update our participants, we have 22 people online now.
Okay, I can actually see the count on my screen. So are you guys able to see the presentation?
Yes, I see it.
Okay, so this morning, as I stated, I will be using the FEPblue.org website, and I'd like to walk people through what you see, basically when you're sitting on your computers at home. So I will use my mouse to kind of show where I am. So you would go in, you would click Our Plans, scroll down to FEP and Medicare. Okay, so that will take you to the benefits for FEP and Medicare. And the very first page, we know what Medicare is. I retired a number of years ago, and I'm on Medicare, and it's been an awakening. I was kind of in denial the first year, so I quickly have gotten over that. So we're just going to stroll down the page, just give us a quick explanation. Here, it says basically you pay 0 out-of-pocket costs when you're on Medicare A and B. So this tells you those co-pays basically went away when you enrolled in Medicare A and Part B. So we're going to keep strolling down. And I stress when you're using this site, this one is for 2020, so don't even spend time clicking there. We're going to do compare plans, which will be for the upcoming year. Just click there anytime you get, and let's make certain this is working. Okay, learn more. Anytime the little hand pops up, click there. Okay. And here we're going to go, and you will notice here again, very first page, because we're still in calendar 2020, you will see that that's focused there. So we're just going to click 2021 benefit changes. This is the brochure that if we were doing this in person with paper this year, this is what I would have put on the table in front of you with an ink pen, usually eyeglass wipes, a bag, and we would always give those out at the meetings. And you guys may miss those bags this year. I've seen a lot of them at Aldi's in the different supermarkets. So we're just going to stroll down. As I said, I'm not going to verbatim read. I think most of us that has been enrolled with Medicare are familiar with a lot of the terms. So we're just going to go down on the Medicare A and B. And basically, we're just going to stroll down, nothing different. So I'm really going to focus on the limited time that I have to go over where we have changes. Anywhere when you're in this website, even the link that we send you, anywhere there's a blue shaded area, that's a hyperlink, a phone number, so you can actually click to get more information. Okay, then you're just going to keep strolling down, combining Medicare, cutting costs. And again, as I stated, when you guys became eligible for Medicare A and B, all of those co-pays you paid when you were active have gone away. It's zero on all three plans, whether you're on the standard plan, the basic plan, and FEP Blue Focus was rolled out about, this is probably the third year, and was really designed for that young, healthy person that says, I never get sick, I never go to the doctors, but I want coverage. So that's the way I explained FEP Blue Focus. So you can see here, standard, the basic, and the FEP Blue Focus are the three plans that we offer. Then we're going to keep strolling down the page. Okay, and then he'll cover these things. Now this will be a change that has been kind of interesting this year, hearing aids. There will be a change in 2020. So in 2020, there will be an allowance up to $2,500 every 5 years for a hearing aid. In the past, it was every 3 years. So again, so that's the new guidelines that the federal government put in place, but anything can be appealed. So just keep in mind, starting 2021, it's $2,500 every 5 years instead of the every 3 years in the past. So usually I get a number of questions when I kind of give that info, but that is the new benefit design. Okay, and we're going to focus on Blue 65. So I'm going to move my mouse here because, again, under the Blue 365 plan, if you're not taking advantage of that, we're going to walk through it because that's a discount program. So I'll walk you through that. So we can keep going down. Your routine foot care, your acupuncture. You notice here under your plan, you get 24 visits per year at no cost. That's not available to the active employees. So you can see here on the standard, you get the 24, but if you're basic or blue option, you only get 10. Personally, acupuncture works. I've used it, so I'm not certain if you guys are taking advantage of that. Then on the dental, this one really creates a lot of concern. When the federal government designed this plan a number of years ago, they put what I called a little bit of dental under your medical. So for example, you go to the dentist, let's say you get a cleaning, and some of you've gotten these small $8 checks, $24 checks, $12 checks. That's because the way they designed the plan, the dental claim goes to your medical first. And if you have our supplemental dental plan, then it will automatically go over to the dental plan if you have your medical with Blue Cross and your dental with Blue Cross. Now, if you have your medical with another carrier or your dental with another carrier, it will not automatically transfer. So that causes a lot of dissatisfaction with some of the members. You get that $8 check, then the dentist sometimes says, well, I've gotten paid $8, they bill you. Just remember they need to file it to medical first, and if it's what we call blue on blue, blue medical, blue dental, it will automatically transfer within our systems. So any questions on the dental side? And we're going to go over more in dental, but that's just what happens when you first go in for those cleanings during the year. Now, someone just mentioned the ability to travel, and I actually got a call this week about a cruise. Would I like to book 24 months in advance? And like, heck no. So under the federal government, overseas care, and I tell folks, if you're traveling out of the country, do not buy those $300, $400, $500, $600 travel plans. Your Blue Cross Blue Shield card provides you with coverage overseas. Medicare does not, but under the federal plan, it does. So don't ever go out to the website and say, I need to buy this extensive travel coverage for medical care outside of the U.S. So what I like to stress is if you're in the hospital, let's say something happens, accident, surgery, make certain that someone calls Blue Cross and let us know that you're in a facility. Then we will start working with that facility, a covered service. We will guarantee them payment. So they're not asking you to pull out your credit card. Years ago, they would say, okay, your bill is $10,000. You would have to put that $10,000 on your credit card before they would release you. So now just make certain someone calls, make certain that we know that you're hospitalized, and we take it from there. Now, the only exception is, let's say you get a prescription drug, you need to go to a dentist. You would need to pay for that service and then file that claim in the U.S. in order to be reimbursed. That will not automatically transfer over. So any kind of questions on the overseas care? The other thing I like to tell folks, let's say the federal government covers you in the United States. So let's say you go to New York, you get sick, you would then reach out to Blue Cross Blue Shield of New York, find a participating doctor, and then basically that claim would go to New York Blue Cross Blue Shield, and they would process the claim the same as we would in North Carolina. So always remember, don't go to the North Carolina website trying to find a doctor in New York. You would go to New York's website to find a doctor that's in their network. So that makes sense? Okay, no questions, so we're going to keep tagging along here. Prescription drug coverage. You notice again here, Medicare A and B doesn't include prescription drug coverage. But if you're on the standard option, you can see here, your tier 1, which is kind of your generic drugs, I like to call it. You pay a $5 copay. You're on the basic option, it's a $10 copay. If you're on FEP Blue Focus, again, some of you guys may have chosen that plan. You notice it's $5, but it is limited because basically you're telling us you're pretty healthy. So we don't expect to see a lot of prescription drugs. You go down to the tier 3s, the tier 4s, you can see what standard option does. Okay, basic, same thing. These are your copays. Now, I also tell folks, sometimes, I kind of shop around. I found that Costco's, Target, different people, I've gone in and gotten a prescription filled like for 84 cents and $1. So sometimes if you go to a different pharmacy than Walgreens or some CVS, sometimes your copays can be less, your out-of-pocket can be less than these copays noted. So kind of shop around as to how you spend your money. It makes a difference. Then we do mail order. So here you notice here under the standard option, you can get a 3-month supply for a $10 copay, tier 2, $90. So you can see here when you pay what you pay for a 30-day supply when Medicare Part B is primary. So you can see that these are the copays. Okay. So you can see here again, Blue Focus, no benefits. Those specialty drugs where the pharmacy is taking a compound based on what your doctor has ordered, then those will be your out-of-pocket costs for those specialty drugs. So that's something your physician would write it. You would take it to a compounding facility, and that will be some of your specialty drugs or compounding drugs. You want to know about the formularies. When you click onto this link, it gives you more information about the formularies. Okay, then you keep going down and you say OPM says prescription drug coverage pays out on average the same amount as Medicare Plan D. Therefore, you don't need to enroll in Plan D, Part D. So we tell you based on your federal plan, there's no need to take that Plan D coverage that I think some pharmacies will offer. I think I've seen signs at Walgreens and different pharmacies. So they're telling you you really do not need Plan D. Okay. Then you go into here, 2020 Medicare A and B cost. Okay, we're going into 21, so I won't spend a lot of time there. Okay, then you keep going down. Preferred hospitals, nothing in preferred hospital until you use your lifetime days. So again, not going to read through everything. You guys have a question, just let me know. Here it goes, keep going down again. You pay nothing for the 30 days. Keep going, using your benefits. Then here, this just is giving you an example of how that claim would process between Medicare and your Blue Cross. So it's just to kind of give you an example of how that claim will be processed, okay? Then you keep going down, your reserve days, gives you that level of detail here. Then Medicare premiums. Most of us are aware now, and at least I am now, Medicare A, we pay nothing. So that's basically free for most people. If they've worked enough, you pay nothing for Medicare Part A. Okay, so most federal employees take this coverage when they first become eligible. Again, if you're still active, you still would keep your normal coverage, but the Part A is free. Part B, there is a premium. So on average is about $144 a month on average. Okay, and then you can visit Medicare.gov, and some people will say based on their salaries when they work, theirs could be more than the $144, but on average, that is the monthly cost for Part B. Now, 3 years ago, and this will be, I think, the 4th year, if I'm not mistaken, the federal government decided that we will give a Medicare reimbursement. First, it started at $600. If the employee and spouse, or if both were federal employees, they would give you up to $600 each calendar year to help pay for that Medicare Part B. Okay. Last year, they increased it to $800. This coming year, it will also be $800. And this is the only group that I've seen around that basically has done a reimbursement to help pay for that Part B Medicare premium. And then we'll walk through what you guys need to do in order to take advantage. Now, the only thing that will happen is you must be on the basic plan to be eligible for that $800. If you're on the standard plan, if you're on Blue Focus, you're not eligible to get that reimbursement. So if you have a husband that your spouse is over 65, has basic, you're over 65 with Medicare A and B have basic, it's $800 per person. That's a total of $1,600 for the two of you during the year. You can be reimbursed quarterly, every 6 months, annually. Most people will not do it monthly, so they will just wait and say, oh, I'll just save this for Christmas. But again, you do get up to that $800 per person if you're on Medicare A and B and you're on the basic plan. So if you haven't taken advantage of that for 2021, go ahead and submit the paperwork in with documentation that Social Security is taking out that $144 approximately, and then Blue Cross will go ahead and reimburse you up to that $800. It is per calendar year. So if you turn 65 in October, it's going to be prorated to December 30th, and then come 1/1, it's a new $800 for next year. So any questions on that particular benefit? Okay, so we're going to keep strolling down here, selecting the right coverage. So here's the cost. So you guys say, what are the costs? So you have self-only. These are monthly rates that's coming out of your pension. So you notice if you're self-only, it's $267 on standard. If it's self plus one, your spouse is also covered under the plan. Or if you have a dependent child that's still covered under the plan, those are your rates. If you're on the basic plan, you can notice here, and what's key, anytime you're making a change, the name of the plan doesn't matter. It's this code, the 104 tells the system, your standard, your self only, the 106, the 105. These numbers are on your Blue Cross Blue Shield card, and it tells our system, which plan you're enrolled under. So here again, on self only, 111, you see the rates, self plus one, and self and family. Now, when I did these meetings over in the past, sometimes I have two federal employees, they're married, they're both eligible. Sometimes it's cheaper to switch to two self-onlys instead of the self plus one. So take a look. If your spouse was eligible enrolled, you have that option to go on the two self-only plans if you choose to. It will save you a bit of money. So I kind of help you kind of come up with ways to save money. Again, that $800 is only applicable here. You will only get the $800 if you're on the basic option. But if you need that mail order drug, or you have a provider, say, I absolutely love my doctor. He or she says, I don't want to sign a contract with Blue Cross Blue Shield. You can get that coverage under the standard option, but not under the basic and not under the Blue Focus. So I tell people to weigh the mail order, weigh your physician being, non-participating in the PPO, and that will help you make a decision there. So any question on the rates? So these are your new rates for 2021. Okay, then we're going to keep strolling down. We briefly went over the prescription drug coverage. Okay, Medicare Part A and B does not include drug coverage, but your service benefit plan does. So by having that FEP Blue Cross Blue Shield card, you have the prescription drug coverage. That's why we tell you, don't spend your money buying Part D, even though you go into the pharmacy and they say, oh, we offer a Part D. You don't need it with your plan. Okay, hearing aids, we went over that. There will be a change in the hearing aid. That's going to be that $2,500. Then we're going to go over this discount. So sometimes the discount may be more to your advantage than the $2,500 every 5 years. Okay, coverage for dependents. Even though you're on Medicare A and B, let's say you're 65, you could be under, could be some medical condition, you have A and B. Dependent children on medical are covered to age 26. 31 days after they turn 26, they will come off of the medical plan. Unless they're on a disability, then they can stay on, that's a medical disability, they can stay on the plan beyond age 26. If you have a dependent who's under the age, who's up to age 22, they're only covered on dental and vision to age 22. Medical covers to age 26. So that is a difference. So again, so even if you need, let's say you have a handicapped child, there's some medical reason the child is still on your plan. Come age 22, they're no longer eligible under the federal government plan. So you would need to shop for individual coverage someplace for those. Any questions so far? Okay. And also, we're not in a position to tell you what best. We can just kind of print out to you guys, here's what the benefits are. If you have questions specific to your family needs, use the Ask Blue. So you can go in, ask questions specifically to you and your family, and they will work with you to decide what really works best for you and your family. Because I can tell you what a lot of people will take, but again, at the end of the day, you know your family's needs, and these guys will assist you without any questions you may have. So any questions, remember, if you have questions, remove me from mute. If not, I won't hear you, okay? Then here, you're going down again. Here's where I address at $800. Okay, so get money back for paying Part B. So here it tells you how the program works. So basically, you submit a claim to Blue Cross Blue Shield. You can fax it to us. You can email it to us. You can send it via paper. This day and age, I would say either fax it to us or basically email it to us. And I have a friend that just got her check. She said it took her about 7 days and they sent her her money. She turned 65 in October. So you need the COLA statement, which you get from Medicare. It's your annual cost of living. So this is one document we take. A copy of a canceled check. If you're paying for the Medicare Part B out of your own checking account, we need a copy of the check. A credit card statement, that will suffice. A bank statement. But most people, I think, we find basically they have that money deducted from their Social Security. So that statement will suffice along with completing the claim form in order for us to reimburse you up to that $1,800 for one person or $1,600 for two people. Again, here tells you the 800 number if you have a question. It tells you the website. You can go in and print that claim form off. It tells you here exactly where you would go to get the information that you need. So we try to make it easy so you know where to go, okay? Okay, so then we go down to the wellness program. And I'm not certain how many of you are taking advantage. We've been doing this for years just by completing a health assessment, a number of questions. We will put $50 on a debit card. So Blue Cross creates a debit card. It puts $50 on for you, $50 for your spouse. And I tell most women if they're married, the husbands aren't going to do it. Just go ahead and fill it out for them because that's $100. So if you haven't completed it for 2020, I would say in the next week, go online, complete the assessment, get the $50 for you, $50 for the spouse if you're married. Okay. Come January, you complete the assessment again, they give you another $50. Then if during the year you say, I'm losing weight, I'm exercising more, reducing stress, they will put up to another $170 for each of you on that debit card. So that tells you that money is sitting there for you to use for co-pays if you have any dental work, glasses. You never lose it, so you can accumulate it, keep accumulating it, keep your PIN number, and when you go to the doctors and you have it out of pocket, pull that debit card out and use it instead of your own personal debit card or check account, okay? Your routine physicals here, you can see here that basically FEP Blue Focus, this particular benefit is only for someone that has elected that Blue Focus plan. Remember, that was the one that has limited benefits. So that little F, so when we say FEP Blue Focus, they give a Fitbit for the people that tracks their walking, going to the gyms. So again, it's only available to Blue Focus, okay? Diabetes program, this is the second year on this particular program, and this is available on standard basic, and we give you up to $100 if you're working with your doctor to get those A1C numbers down. You report it to Blue Cross, they put another $100 on that debit card, so you can see how that money is adding up. Okay, so then we offered a new program. This is La Gringo. We did this last year. This one will actually send you the test strips, a blood glucose monitor. So basically, you would just call Blue Cross here, FEP Blue Diabetes. You can roll into these plans, get that monitor for free, get those test strips, and that basically will walk you through, and that will save you a great deal of money here. Okay. Then you go down. Remember, I mentioned those discounts for hearing aids, and my link won't work here, but I'm going to go back and show you where we would go into what some of those discounts are. Okay. So then we keep going down. Many of you, if you're not enrolled in Medicare, we tell you here's exactly what you need to do online, by phone, in person, which I think you have to schedule appointments now, but here's what you would do. Delay in Medicare enrollment. A couple of years ago, we did this. That person becomes eligible for Part B. They say, well, I'm not going to take Part B, which that's the case. But anytime that you do not take Part B, when you become eligible, there's a 10% penalty increase for each year that you chose not to. And it's not a one-time 10%. So let's say you wait 3 years. Then it's a 30% increase. So I tell people, yep, if you're going to keep Part A, you're going to keep the federal, then really take a look at taking that Part B of Medicare, because if you decide 3 years later, it's going to cost you 30% more than what it would have cost you if you had signed up when you first became eligible. Now, if you're still working, there's no need to take Part B. It would be when you retire. It's when you retire and you're coming off of an active group plan. So any questions? Okay, so I'll pause. Okay, here's the general enrollment period. Okay, open season. Think open season started November 9th. It's going to end on December 14th. So I tell folks, don't wait until December 14th. We have a storm, system goes down. The federal government has never extended that open enrollment window for any reason whatsoever. Okay. So remember, if you start doing it, you get distracted. Try to remember to go back in and finish it, because if you miss it, if it's not in by 12:01 on the 14th, then that change will not be effective in 2021. Okay, so just going to stroll down some resources. Again, we're just giving you some information, so you got everything that you need. And this is one of the documents that I will forward to Tom, and he can put it out on whatever site. You can save it on your personal computers at home. You can stroll through at your leisure, but this gives you all of the phone numbers and all of the links if you need additional information. Okay. Okay, the other thing, every one of us have a smartphone. So this is one I really stress to folks is, if you have an Apple device, go to the Apple store. You can download the Blue Cross Blue Shield app on your cell phones, your iPads, your computers. If you have a Droid phone, go to the Google. It will give you a digital ID card. So if you don't have your paper, you can pull up your ID card. You can see your out of pocket. You can see everything that you do on that app. We'll leave our purses at home, but if we forget our phone, we'll turn around and go back and get that phone. So you kind of always have the phone with you. Okay. And then here's service benefit plan again. So you can notice here, we go to customer service question. Here to learn more, 410 blue. So we tell you exactly where you need to go. You can see their hours. Okay. Here, the National Information Center, telehealth. And teledoc. This is probably going to be crucial. And someone mentioned COVID, and I forgot the young lady that spoke earlier. A lot of doctors are not seeing patients in their offices as we deal with COVID, we deal with the flu season, we deal potentially with pneumonia. So on telehealth is where you can actually do a video chat with your private doctor or someone in that office. There's still no copay. You call the 800 number. You can do telehealth and not have to sit in an urgent care in an emergency room. You can basically talk to your doctor. I would tell folks, have a thermometer. So if they say, what's your temperature? You can tell them. So that's something that will stop you, avoid you having to sit in an emergency room or urgent care if you just have an ear infection, something is going on that you need to reach your doctor. Okay. Your nurse line here if you need assistance. Again, we reinforce that Medicare reimbursement account again, because that 800 means a lot. Okay. So any questions so far as I switch over to our dental plan. So I'm going to go back. Okay. And I always take you back to where I went in. I go to our plans again. I'm going to click dental and vision. Okay.
Diane, I've got a question. What about chiropractic services?
I think, okay, those are also covered under the plan, and I'll jot that down and I'll go back to the medical in a second. Okay, and give you the number of visits, because there are a number of visits that you get under the standard and under the basic plan. So I'll click back to that when we finish this one. Can we pause that for 1 second? So I jotted a note there.
Well, you-
Okay. So here we've gone into the dental. Excuse me, the vision. So this is dental and vision. The good thing is, I think you know that in past years, Blue Cross Blue Shield called it FEP VIP. We had these strange names. So the dentist or your eye doctor would say, I don't know, is this Blue Cross? I don't know. January 1st, 2020, the official name will be Blue Cross Blue Shield Dental or Blue Cross Blue Shield Vision. So we're not issuing new ID cards. The system will automatically now show that new name. If you do that digital ID card, okay, then you would see the Blue Cross Blue Shield Dental, you would see the Blue Cross Blue Shield Vision, but we're not going to automatically trigger new ID cards for 1/1. But if you'd like to request one, you can. So we're going to scroll down again, and we're going to see here, we're going to go specifically into dental first. So this is the supplemental dental that I mentioned, that you have a little bit of dollars or a few dollars under the medical, but this is the supplemental one that we offer. Okay, under both plans, you get 3 free cleanings a year under both plans. Okay, so I'm going to go into another page here because now I'm going to say I want to really dive into the dental. So I'm going to click here. Okay, so then what this is going to do, and the first thing folks ask me, what is it going to cost? You can notice here, we said a premium finder. So I'm going to put in my home zip code. And if you put in your home zip code, it will tell you specifically what your premiums will be. Okay, show premiums. So you can see here, if I'm self-only, you guys are monthly. So if you're on the standard option and you're self-only, it's going to cost me in Durham $24.74 per month. If I'm on the high option, which is that really richer, what I like to call a Cadillac plan, if you know you need extensive dental work. If I'm self plus one, okay, if I'm self and family, but let's say you have a spouse, he has the best teeth in the world, you can choose the self plus one on the medical, but you can do self only for dental. They do not have to match each other. So take a look at your own dental needs and your own vision needs when you're selecting a plan. So they do not need to match. Okay, then we're going to scroll down. We say, okay, there are 2 plans, high option, standard. Okay, you notice here in network. So make certain you either check with Blue Cross or your dentist in network, 100% for those exams, cleanings, x-rays, sealants. Okay, standard, again, 100%. Go out of network, you pay more. Here's the cleanings. You get 3 each year, which is kind of unheard of. Normally we get 2. But let's say you need oral surgery, fillings, 70% under the high option, 55. So you can see here that price difference says you're going to pay more out of pocket. Okay. Then dentist says, wait a minute, you need implants, you need a root canal, you need dentures. 50% under this plan, 35 here. Go out of network, it's almost paying nothing. You can see here. Okay. No deductible in network, 50. You can see here, if you go out of network, you pay a small deductible, not a lot. Then you go down. This is when I tell you, if you and your dentist know you have extensive dental work, this is unlimited. So let's say you need an implant, you need dentures, they say you need a bridge. We pay 50%, you pay 50 with no dollar max for that calendar year. Now, under the standard option, we're going to cap you at $1,500 for that calendar year. And that's going to be everything in Class A, which is here, Class B, and Class C. One visit could use up that $1,500. So that's why I say, if you know, you talk to your dentist, you know what you need, that $1,500, once that's used, the benefits are gone into the next calendar year. Okay. You see, if you go out of network, we limit it. So again, $3,000 per person here, max, $750 here. So it's again, talk to your dentist, and I tell folks, if you know you need extensive work, ask the dentist to do a pre-treatment estimate where they will submit a pre-treatment estimate as if it's a claim. We will process it and look at it as if it's a claim. Then we will send you a statement saying, here's what we will pay. So you don't get sticker shock when you get the service done. And he said, wait a minute, you owe me $8,000. You weren't expecting that. So if you need extensive work, do the pre-treatment estimate. It saves you a lot of money, and it saves you basically from to get that kind of sticker shock here. Someone needs braces. Okay, you got a dependent here. No waiting period. But again, we will only pay up to $3,500 under this plan, $2,500 here. This is a change for 21. before you would have to be enrolled in this plan for an entire year before you were eligible for braces. This coming year, there's no waiting period. But again, you're going to be capped at the 2,500, and then here you will be capped at the 1,500 per person here. So any questions? I think that's pretty much everything. If you're currently not enrolled in our supplemental dental plan, this is giving you the enrollment, the phone number. Okay, this is giving you the brochures. This is giving you find a dentist near you. Anywhere that little hand pops up when you get this, basically you click and it will take you into where to find these providers. So I got one question in the parking lot now. So anything on dental? Okay, and so again, just, you know, put your home zip code in and you can go for the rates. Okay, move the mouse around. So we're going to go back and that pretty much covers everything on the dental side. So now we're going to go into the vision. And I think I had already saved the vision brochure. So let's see if it's going to be user friendly to me this morning. Okay, here's the vision. Okay, so most of us are wearing glasses of some type here. Okay, so again, this is just get high level. I'm going to click here because it's going to give me my rates. So it's going to tell me what is it going to cost me. Okay. So we're going to open this up. Okay. And where I like to go, the first thing people are, okay, what is it going to cost me? So before I go into the, and actually I'll scroll down. So these are some of the providers: VisionWorks, LensCrafters, Costco, Sam's, Walmart. We actually also added Target to our network this year, so you can go in Target and get your glasses and contact lenses. Okay, so this is just some of the providers that are in the network. Okay, so I'm gonna stroll back up and say, okay, what is it gonna cost me? Get this mouse to work here. I'll stroll back up. So I'm just gonna go into benefit information and pricing. Okay, so you can see here, you know, for savvy folks, we can order contact lenses. We got a 1-800 contacts. We got glasses.com. So you can see there's a lot of ordering eyewear online. So that can sometimes save you a great deal of money too. Then we're going to stroll down and say coverage. Here's 2021. Eye exams once per year, no copay, covered every calendar year. On your lenses, no copay. Under the high option, you pay $10 under your standard. These are some of these lens treatments that are going to cost you more money. It may be lower, but it's going to add to the cost of those glasses and lenses that you're purchasing. Okay. We have a list of exclusive collection that are really less expensive. We've chosen select ones. Now you can pick anything out you want, but if you use this selection, usually going to find the cost more attractive here than just going in and picking out. But again, you know, you decide. Your frames, no copay, covered every calendar year. Under this option, this last year was every 2 years, but they're changing this now, no copay every calendar year. So now you can get your frames every calendar year under either plan. Okay. Then you say we will allow up to $200 on the high option. Okay. $140 on the standard option. So you can see here, $60 difference, but you know, it adds up. But that money that you put on that debit card for doing those activities, you can use those dollars to help pay for those glasses and lenses. You can use it to help pay for dental. Okay, so if you're accumulating the dollars, okay. And then I tell folks, you cannot do contact lenses and glasses the same year. So let's say you decide I want to do frames and lenses in 2020. So you only have another month or so to do it, a little less than a month and a half. Come next year, you want to say, okay, I want to do contact lenses. Okay, so then that year you can do contact lenses, but you cannot do both in the same year. So it's either or. Okay, then we're going to stroll down. Next, we're going to say, what's my cost? Cheaper than going to any fast food place that I'm aware of. If you're on that high option, you can see you guys are monthly. It's $11.90 per month. The standard is $7.58. Self plus one is $23.77. $15.15. If you have family, you have a dependent that basically is under the age of 22. You see here, and usually it's rare that on the family for dental and vision, because once that dependent becomes 22, they're no longer eligible. So you're either going to have self plus one or self only. Okay, hope that makes sense. Okay, so here you can see there's some more links to different documents here. So, okay, this is just for 2020, little tongue twister there. So you can see that there was an increase in the allowance. So it tells you if you haven't used those dollars so far in 2020, this is what it will pay for this calendar year. Okay. I did mention additional discounts. So we're going to click here and say, okay, what are those discounts? Okay, LASIK surgery. I did it a number of years ago. It works. You know, you guys may be something you're not interested in, but basically I had it on one eye for distance and I didn't do it on the other eye for close up, and it's worked fine for me. But LASIK is a discount, so you can get 40 to 50% off. Okay, if you want to know more about it, click that hyperlink. It'll give you more about the LASIK if you and your doctor agree. Remember, I mentioned hearing aids. Now, under the medical, remember, we're going to cap you at $2,500 every 5 years. You notice here you can get discounts up to 40% off of premium hearing aids. So this is something to take a look at, you know, as you're shopping around to get your best price. So you can see some of the warranties here. Hearing exam is free, 60-day money-back guarantee, 1-year follow-up. Okay, 4-year service warranty, including 1 year of loss. Wow, that's interesting. 1 year of loss of damage covered under the hearing aid discount. Okay, just gonna stroll down. And then to learn more about it, here's the phone number. So you can see here, I want to know more, or I call the phone, or I click the link below. Okay. Then we go down and we say, okay, Blue 365. These are discounts. We all have families, you know, it's the holidays. You can get discounts on sports equipment. You can get discounts on sneakers. So you can see here, it says Fitbit, especially with some folks, when they walk, they want to keep track of, you know, their steps, etc. So see, you can see here, so here you can see holiday special up to 33% off. Okay, then you keep strolling down. It gives you more information on the discounts. So you say apparels. A lot of kids are into designer sneakers, but you can see on Skechers, good shoe to me, you can get a 30% discount off of that. Okay, so you just keep strolling down. And here, as far as going to gyms, you know, a lot of people are going to gyms now. You would notice it's a $29 monthly fee. A lot of them are cheaper, but you can see by having that Blue Cross Blue Shield ID card, you can get discounts there. So just, you know, kind of look at the different categories, you know, when you have time, and just go through. And if you want to say, I want to review all deals, like say someone mentioned travel. If I click travel, just by you having that ID card that says FEP Blue Cross Blue Shield, this gives you an idea when we do feel safe traveling again, which honestly, I don't know when it's going to be, but it will tell you, here's some of the things we have discounts. They do change. So always kind of take a look based on what you may be looking for, because you may find some extra savings out there. Okay. So that's everything on and I think that covered everything. Go back, see if I missed anything. And I don't think I did. We did the discount program. We went over the wellness benefits. I'm going to click back to medical in a second and see about the chiropractor, see what the max is. But that's everything there. Okay, and then I click the wrong one. Sorry, guys. So, and I can go this way. I can go back to FEP and Medicare. And again, these will be forwarded to you guys for you to have and save on your iPad, your computer. You know, you can save it to paper, you can do whatever, you know, but, you know, it will be there since we didn't give you paper this year. I'm going to go back into the 2021 benefits and see if they put a cap on the chiropractor. So get my mouse to move here. Okay, we're going to stroll down to the medical, where you see, okay. So, okay, sorry, I'm not saying, you asked the question, it's a zero copay for up to the first 10 visits. So, 12 visits if you're on the standard option. If you're on the basic option, it's zero copay for the first up to 20 visits. Okay, so does that answer your question? So then you can see here, physical therapy gives you the max on this here, because if you guys weren't on Medicare A and B, there would be an out-of-pocket. But see, that Medicare A and B eliminated all of those out-of-pocket dollars that you would pay just by you carrying that ID card. Okay.
Appreciate it.
So did anyone else have a question? And I think, Tom, that you want me to attempt to address the question you asked before the meeting started?
Yes, if you would. I mean, what the question I asked Diane earlier when we were doing the video audio check was, I told her how I'm seeing all of these commercials on TV about calling Medicare programs, Medicare hotline, because you might qualify for all these free things, free rides to your doctor, free meal delivery, free blah, 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 but you must call because you have to ask for these things to get them. So, so I asked Diane, does Blue Cross Blue Shield offer any of these free services that I've got to ask for to get?
Okay. And Tom, is not you asking us, basically it's the Med Advantage program. And as a federal employee, there's no cost to you on these, so you can elect to add this on top of what you have now. So let's say you have basic now and you're on Part A, Part B, you pay your monthly premiums. You can add that Med Advantage on top of the plan that you have today. Okay, and you will get those dental services, that eyewear, meals delivered, rides. Okay, so you can add it on. What I do stress, okay, so you will still pay the monthly premium that you pay now. If you decide to go that route, and I stress to folks, if you want to not pay the premium to Blue Cross Blue Shield any longer for the monthly premium, do not use the word cancel that coverage. You want to say, okay, I'm going to try one of these Med Advantage plans for a year. You would want to use the terminology, I would like to suspend my coverage that I have today. You use the word cancel, you cannot join again. So you can suspend that coverage you have with us today, but you do not want to use the word cancel. So let's say you want to try it for a year. You can try it for a year. But again, you may say after that year, wait a minute, there were restrictions here. I didn't think the benefits were that great. Then once you suspend, you're able to come back to the plan the next open season. You can't do it. So once you make that decision, it's going to be for an entire year. So you can't go and say 3 months later, I would like to go back. So once you suspend, it would be for that calendar year until the next open season. So I hope that answered your question. If not, we'll see what we can do.
Yeah, thank you.
Okay, so please, guys, do not ever say cancel and you want to come back. They're going to tell you no. So suspend is the route you want to go if you want to do that. And if you do add that on top of your coverage you have today, they would become primary if a claim were to come in, but you still do have those benefits. But it's still not going to pay any more than what it would have paid with most of your out-of-pocket zeros for everything. So it's not going to cost you anymore except your monthly premiums and your co-pays on drugs and the other issues. So I would say shop around, compare, but call that 1-800-810-410-BLUE to kind of have them help you through specifics, because I don't know your family dynamics. Okay. Did I miss anything, Tom, or anyone else on the call? I'm trying to go back through my notes here and see if I've missed anything.
Yes, let's open it up to anybody that's got any question for Diane about Federal Employees Program. Wow, Dan, it seems like you've answered everybody's questions.
Yeah, I try to do this thoroughly. I try to think outside of the box and give you guys information that you will need. And Tom, I'll make certain that Sonia sends you these 3 PDF files for you to load those onto whichever system you keep your informational info. And then basically they will have those at their fingertips. And please, guys, load that telehealth app onto your phone. And I forgot to mention, there is one more, and I've used it twice in the last year. It's called TeleDoc. And TeleDoc is not a Blue Cross Blue Shield network, but it's a group of doctors for like routine things like ear infection, sinus infection, you have a migraine headache, you have a rash. You can actually call a doctor 24/7. And when I've called, within 10-15 minutes, I've had the doctor respond back, may have some questions. They then have sent the prescription to my pharmacy, and all I had to do, I had an ear infection, sinus infection, and bronchitis all at one time last year. So my doctor gave me a med. I took it, didn't help. I called TeleDoc. She sent me in 3 more prescriptions, and I just drove up to the pharmacy window, picked it up, paid for it, and drove off. So kind of download that. And I tell folks, add it to your cell phone now. When you're not feeling well, the last thing you want to do is look for an 800 number, look for a credit card, look for your member ID. So maybe if it's quiet over the holidays when we're not shopping on Black Friday, that benefit is available today. So you can go ahead and add that to your cell phone, to your iPad. And usually I say those devices because usually you're carrying those two devices with you. And then when you do need services, you just click that icon, you just type in, here are my symptoms, hit submit, and then usually 10, 15 minutes, that doctor will call you back. Okay, so that's another little benefit that you want to use when you download that app to your mobile devices. Okay. So if there are no other questions, again, I would like to thank you. I see some very beautiful homes there. If it wasn't for the COVID, I would be inviting myself over to a nice home cooked dinner, but I guess I'm stuck cooking my own since I live alone. So I'm left cooking my own. So I'm gonna go buy collard greens and stuff today and wash them tonight. And then I plan to just watch parades and football on Thursday and not see anybody. But when we get better, I'm going to invite myself over to someone's house for a dinner somewhere. I don't care if it's in the backyard or what we do.
Diane, that was a superb presentation, and I believe Carolyn London, my co-president here, wanted to say a few words. So, Carolyn, if you want to unmute and have those words to say, please. You need to unmute.
I think I have.
Okay.
I wanted to thank Blue Cross Blue Shield for an offer that they have made and funding they've already provided. When we were changing our logo and going through the branding procedure back, I don't know, a few months ago, Sonia approached me wanting to know how Blue Cross Blue Shield could help us with that. And so Blue Cross Blue Shield will fund about half of what it would take for each of us, each of the 30 chapters in North Carolina, to have pop-up banners instead of the banners that we now have with the old logo. And I really wanted to thank Diane and everyone associated with Blue Cross Blue Shield for that generous offer to us. And we'll be getting back on that. Henry Bratley is working on some designs, and when he has those, we'll go further with that. But I do thank you very, very much for coming today and giving us such a great briefing and be sharing with us the information for 2021. It's so important to all of us who have Blue Cross Blue Shield, and I'm sure helpful to others who might want to ask their providers or compare what some of their providers might offer to them.
Okay.
Thank you again, and thank you for coming. Have a happy Thanksgiving.
You too, and you guys be safe.
Thank you very much,
Okay.
Diane.
Okay, thank you.
Bye now.
Yeah, bye-bye.
Very good presentation, Diane. Really appreciate it.
Okay, thank you. I am bowing out now.
Thank you again, Diane.
Okay.
And are you going to wash your greens in the washing machine?
No, I'm from Mississippi, so I know how to use the yellow metal tub in the backyard and go wash them and hose them down. So I'm gonna get all of the dirt off of them. Then I may add a few
I've done
turns.
it in the washing machine on the gentle cycle.
You're
and it
kidding,
works.
really? I never heard of that one before. That's a new one.
It
Yeah,
works very, very well.
Well,
That's
see,
right. We know people that use the washing machine here, Diane.
Well, see, I don't know where you guys live, but I go out to the farmers market in Raleigh where they have pre-washed these damn things. So it's like,
Okay.
I ain't never seen that much dirt on mine, but when I go downstairs and I look at that washing machine, I'm going to start laughing. That's a first. That's good.
I grew up on a big farm in eastern North Carolina,
Mhm.
and we had acres and acres of collard greens, and
Okay.
that's how I did mine.
Okay.
Take them out of the field and put them in the washing machine.
Okay.
On a
That's
gentle cycle.
Okay,
So
that's a
that
good one.
does
I won't
that-
forget that one. Okay.
Thank
But you guys
And
be safe out there, and as you stated, be safe, enjoy your families, and we hope to do this in person again next year because I actually miss meeting people face to face. So
okay, and thank you, Diane. And I want to remind our folks on the call today that today's meeting, as our previous settings, are being recorded, and so the recording of this meeting will be available later. So if you thought you missed something or wanted to see it again, you will be able to later.
okay.
So we're going to return to the agenda now, and I believe at this point we're going to go through our actual committee reports. So the next thing would be membership, and Carolyn, I believe that would be you, would it not?
It would.
Okay.
We this does not look like, well, anyway. We have 153 members now. We've lost some who've dropped their dues, but I'm working on getting them back. We have one new member that I recruited last week. I don't know if Julius is here, but if he is, welcome. And if you have questions about us, please get in touch with me. And we're very, very happy to have you. This was Julius Piles.
Yeah, he's not on today,
A
unfortunately.
new recruit. Anyway, and then I wanted just to mention a couple of things to you about membership. If your membership is about to expire, you want to go ahead and renew now because the dues will increase on January the 1st for from $40 for national dues to $48. You can go ahead, renew now, and that locks you in at the $40. So if you're interested in that, there's some paperwork that I need to get to you. Also, if you're interested in dues withholding, we have an incentive going right now where the North Carolina Federation will give you $20 just to convert to dues withholding. You would not send any money at this time. It would take OPM 60 to 90 days to process your paperwork, but that would also lock you in with the current rate for national dues withholding, which is $34. And then, so you would divide 34 plus 10, which is chapter dues, by 12, and that's how much it would cost you in a year. Again, there's special paperwork for that. If you want to convert, please be in touch with me. Of course, recruiting is our top priority right now, and we want very, very much to recruit as many people as we can. It's quite difficult because we don't have the health fairs and the sources that we've had in the past, but we hope for better luck in the future. I recruited 18 people during the health fairs last year. I think I've only recruited about 5 people this whole year. So recruitment is down, but that's not what we want. So I urge each of you to try to improve our membership. If you know anyone out there who has ever worked for the federal government or who is retired or who is an active employee, please contact them and let's try to get them on board. And I appreciate any help there that you can give me.
Carolyn, this is Pete Etkoff.
Yes,
And,
Peter.
I found that there was a EPA Retirees Association, and evidently there's a national EPA member association. And I'm thinking that if we have that, there should be one for the VA and maybe for the post office and maybe some of the others where we could go out and maybe let them know that we exist and and pointing toward our meetings and our website. And I was wondering.
Good. If you'll send me an email about that, and or we can talk about that. Certainly, we're interested in any possible way of recruiting. I'm working on an article I hope I can get to into the newspaper, which tells what NARF is and what it does. I don't know if I'll be able to do that or not, but I'm working on that right now.
And Carolyn and Pete, I did invite the EPA retirees, group to today's meeting. I sent an email to John O'Connor, who's the president, and Bob Blazak. And I think their group is like about 200 members. And we did have, I believe, 3 of their members who joined our call today. So hopefully we'll get some members from EPA. And there were some others that couldn't join the call that sent me emails that said they would like to be on our next month's call. So that will be hopefully another organization we can tap into.
That'd be wonderful. And let's try to get some information out to them as soon as possible. I have a lot of materials, application forms, all of that. Yep. So
yeah,
if anybody needs that.
Yeah, I sent that to them as well in the invitation and our websites. And so hopefully we'll see some applications coming in.
Oh, that'd be
so maybe
wonderful.
we should move on from here to the newsletter and hear from Dave Salmon.
I thought perhaps he left with
Dave,
Nancy.
You need to unmute.
Dave, are you still here?
Yeah, he's still here.
Yeah, I had to unmute. I don't have any big news today. If someone has something they can't wait to send me, you can go ahead. But otherwise, at our December meeting, I'll do the reminder then to get submittals for the newsletter that I will do right after New Year's.
Well, and I just wanted to thank you for doing such a great job on keeping that together and putting that together, and that was posted on our Facebook page, and I also added that as an attachment to today's meeting so that people could download the attachment and see the newsletter if they hadn't seen it elsewhere. And also for our guests that today, I also copied that to the EPA Retirees Organization so that they could see who we are and what we do, and maybe that will be an incentive for them to join our organization. So I think that's a great marketing tool for people to be involved. So thank you for your excellent work on that.
You're welcome. If the newsletter gets OMB approval, we'll know it's okay.
Excellent. All right.
Okay.
So the other thing, I don't think we have anybody on from Alzheimer's, but Carolyn, you may have something to say about that and or the calling committee.
I wanted to tell you about a little story that Vivian Vayer, who's the Federation Alzheimer's coordinator, presented at the board meeting last week. And that is that she was a little bit concerned about some of the slowness of activity and checks coming to her for Alzheimer's. And she said then she got a little box that was like a check book that had checks in it. And she was so curious about that, what that was. She opened it up, and it was from Helen Hilderman from the Durham chapter. And it had something like $4,000 in checks that people had made contributions to Alzheimer's. So she was very excited about that and very pleased. And as of now, the Durham chapter is leading in the number of donations for this year. There's still time if you have money that you want to send to Helen Hilderman, please do that. She is our chapter Alzheimer's person, and she's working very hard to keep us competitive.
That's wonderful, wonderful news.
Remember, all of the money that you donate through NARF is used for Alzheimer's research. It's not used for admin costs or anything like that. We are approaching our $13 million goal, and hopefully we'll meet that the year that we are 100 years old, which is next year. So that is an ongoing project. Thank you.
I've received 2 checks that to supplement what we normally receive during the Alzheimer's raffle. And I want to thank Carolyn and Gail Carly for their generosity. That has put us into the black as far as being able to fund $25 memorials for people who have passed away. Anyway, thank you very much.
Peter, do you want to give us your treasurer's report at this point?
I could. Right now, since the reduction in the per capita, we have increased our working balance by roughly $1,000 over the past 2 years. So we're in really good shape, I think, and we're meeting our obligations. We have not received our mail permit balance back yet since we closed our bulk account. I may just have to go to the post office, but I figure that with the election going on and the Joy's management has put a crimp on some of their activities. So I think if I haven't received anything from the post office after the beginning of the year, I'll go back. It's a small amount. It's $81.49, but it's still a balance. So I think we're in good shape. And like I said, and we continue to pay our bills. And I want to thank again Carolyn and Gail for their generous contributions. So if you feel like you want to contribute more to Alzheimer's, you can do it through sending a check to me, and I'll deposit that in escrow for further future memorial fund payouts.
Thank you very much. The calling committee, I'm not sure if it's operational right now. I've not talked with Fred Hawkins for quite some time. I don't know whether he's out of town or what the deal is, but I just have not been able to connect with him. And he's the chair of the calling committee, but I'll try again to be in touch with him. At our last meeting, I asked for volunteers to serve on our nominating committee so that we could present a slate of officers for 2021. According to our bylaws, we present in November, we vote in December, and the new people take over in January. I was very, very disappointed because I only heard from one person about the officer positions. I did talk with Tom, and what we are doing now is we're going to be, Tom, I hope, is going to be taking the leadership, though I'll be with him to help him. So I'm still putting us down as the possible co-presidents of the chapter. Mary Vickers and Cheryl Harrell have been doing a great job of programming as our first vice presidents. So we've put those on the list. Frank has been so very, very helpful to me in recruiting and in membership, helping with membership. So I've left him as the second vice president. Anna Maria Cox has agreed graciously to be our secretary nominee for our next year. And Anna, thank you so much. You've been doing a great job with our minutes and all the other things we've asked of you. And Peter and Clyde have been working as our co-treasurers. I'm not sure how much Clyde is involved with that, but I do know Peter is doing a fantastic job, and we thank you very, very much. So I've left them as the possible officers for 2021. Now, our committee chairs are going to be the same unless somebody withdraws, but there are room for volunteers. We welcome volunteers. As you know, a lot of work goes into keeping our organization strong and viable. You get out of it what you put into it. So we have 5 or 6 or 8 people who are doing most of the work. And we would love so much to have some of our newer members volunteer for some work. So if you are willing to do some work to help us keep going, please be in touch with Tom or with me, and we will work out the way, we'll work out an arrangement for you to help us in any way possible. At our next meeting in December, we will have this proposed slate of officers, plus we will have nominations from the floor. So think about it. If any of you are interested in becoming an officer or a chairperson or helping anyone, we would be very, very grateful. I've put myself on here as the service officer because we haven't had anybody step forward. I've tried a couple of people, and the service officer is the person who makes contact with our deceased family members to offer them advice and assistance in contacting OPM or anyone else that they might need to contact to get the affairs of their loved ones settled. We had one death this year, this month, and that was Annie Taylor. I did talk with Annie Taylor's daughter, and we hopefully have helped her. She had gotten her packet from OPM the last time I talked with her, and I told her if she needs any further assistance to be in touch. So that is where we are with the officers. Again, I urge you to let Tom or me know if you're interested in participating in any of our programs. We have open space for everyone to participate.
And I'm happy to pay anybody $20 to be a new officer.
Well, that's fine if that's what you want.
I'm just kidding.
But I'm happy with you where you are, and I appreciate all that you're doing to make our meetings virtual.
We appreciate everything that everyone's doing.
And I do. Thank everybody. I do want to also ask for volunteers to audit Peter's records. I think Dave Salmon and I'm not sure who else have audited the treasurer's records in the past, but we need to do that once a year.
Yeah, I will. I volunteer to help with that, Carolyn.
Okay, great. And Mary has sent you a note that we're the 3rd Tuesday in December, not the 4th. Our next meeting.
Yes, Thank you, Mary. December
Yeah.
15th.
Yeah, right. So that's where we are at this point. Now I'd like to just open the floor to anyone who has a comment or who would like to add anything to today's meeting. Anybody out there who has an urgent feeling for us or something that would be helpful for the chapter or something we ought to do that we haven't done?
Somebody tried to reach you.
Another thing, and that is usually each year about this time, we do something for a local charity. I'm open to suggestions as to whether we want to do that this year and to whom and how we go about that. I don't know if any of you know about the food pantries or what is needed, but I hear so much about food insecurity that I think it would be nice if we could somehow help the food banks, or I know a lot of you do that individually, but as a chapter. Does anyone have any comments about that? Nobody has a suggestion about some charity we might participate with?
Well, last year, didn't we contribute to Open Door Charities?
We did. We brought food, and yeah, we did.
Yeah.
I don't know quite how we would work that.
Well, I think that all of these charities are happy to accept gift cards to grocery stores. For example, one that I work with in Orange County is called Porch, P-O-R-C-H, and Orange County Ministries in Action, and they are delighted to help. They're delighted to accept, gift cards to Food Line or Harris Teeter or any grocery stores, which help them to buy groceries, to replenish their shelves at their food bank pantries locally. So,
Right.
So we could actually, we could actually, I don't know, we could contact them and ask them the best way. We could put together a list of our Research Triangle food banks, to see how they would like to receive donations. It could be personal checks, it could be gift cards, it could be, I don't know, they'll tell us.
What about food? Just boxes of food, or?
And I'm sure they would accept boxes of food. For my local one, which is Porch, usually they will accept, bags of groceries at any time. You just go there and drop them off, and that helps to put cans of food, and they have guidelines for what type of food they want. Canned food, dry goods, pastas, that sort of thing. So I'll be willing to contact, North Carolina Food Bank and our local ministries in Durham and Chapel Hill, and see what they would most like to have, and then send that out to our members.
I would like very much to contribute.
Salvation Army.
I'm sorry, go ahead.
It's Dale Crowley. The Salvation Army is also doing a gift giveaway for seniors and disabled adults called Silver Bells, and they're looking for contributions for that. These people submit a request for something they need, and they receive it for Christmas. Now, I actually found out about this because I had 2 people give me used television sets, and I actually managed to get those into the Silver Bells because they didn't have money for TVs. So the Salvation Army is accepting money for that as well for people who are disabled and low-income seniors.
Oh, great.
So I'm just suggesting that's another opportunity. And they're in Durham, and they serve Person, Durham, and Orange County.
Mhm. Well, certainly I would like to contribute. If you all come up with an idea, let me know and we'll go from there. And we're getting a message from Mary Vickers that last year we donated to Open Table Ministry. She has a point of contact there. So
So maybe if we could put together sort of a just a listing of these ministries and whether or not they accept donations of goods, and do they take used items? Like I have a set of telephones that are perfectly good, but I'm not using, like, handsets and stuff like that I could donate. Or do they accept cash? Do they accept gift cards? Can we take them to a place in person and drop them off? Do they pick up? Those sorts of questions would be, if we could find out the answers to that, then we could just send that out to our membership and say, here are a list of options for donations for Christmas.
Tom, this is Pete Eckhoff. Crandon Institute refurbishes computers and donates it to vetted Beniti kids. And with all the lockdowns and the school closings, computers are needed. So if you have computer equipment that you want to donate to them, you can drop them off down at RTP, or if you want to, you can give me a call. I'm at area code 919-597-8391, and I'll come by and pick up your stuff and take it on down to them.
Oh, that's great. So how about this? If everyone here, like you, Pete, and Mary, and Gail, if you will simply send me an email with your ideas about, Silver Bell Gift Away and the, RTP computers and the Open Table Ministry, I'll concatenate these in one document and email these out to everybody, and say here's a bunch of options for making donations for Christmas, and here are the people that will put you in touch with those people, and then I'll send that out to everybody.
that'd be great. And I certainly do want to contribute in some way. And we do have some computer equipment that could go somewhere.
So let's say if everyone can, if folks that have ideas about doing this can get their ideas and the contact information and all the information they have to me by let's say the 1st of December, around then I will put that together and send that out to our membership. Does that sound good?
Yes,
Sounds like
that
a great
sounds
idea,
good.
Tom. Really
And then
appreciate it.
and I'm going to say I'm just going to give you a deadline of let's say December the 4th, which is a Friday, December the 4th. If you'll get your information to me, and then I'll turn that around and get that sent out to everybody by Monday, December the 7th.
Thank you, David. We're happy to have you here, and hope you'll be back again soon. Would you send your email to Gail Crowley, please? Tom?
Yes, I will.
Okay, good. All right, unless there are some other announcements or some other comments we need, I'm ready to adjourn the meeting if you all are.
I'll
I
second
still
it.
need a volunteer for the for the nominating committee for the Federation. Tom, did you say you might do that?
What was that again? Could you repeat that, please?
A member of the nominating committee for the Federation. Fred Hawkins served in that role for many years and
Yes.
said he can't do it anymore. Would you be willing to be the Area 4 representative for?
Yes, I will.
All right, I will let Henry Bratley know then, and thank you so very, very much.
Absolutely.
Okay. Anyone else? Thank you so much for coming, and happy Thanksgiving. Be safe, and we'll see you again on December the 15th.
Yes, I'll second that. Thanks, everyone. What a great meeting.
We'll adjourn at this time.
Bye, everyone.
Bye.
Happy Thanksgiving to y'all.
Same
Happy
to everyone.
Thanksgiving.
Yes. Be safe.